Today's lecture is on interpersonal communications. Elements of communication. We call this the communication circle. The source sends the message, the receiver gets the information and gives back a response. It's called feedback. And it can be influenced by noise, whether internal in your head or external in the area, which affects the circle. So this is like the old telephone game. I'm going to tell you something, then you're going to tell the person next to you, and you're going to tell the person next to you. And when we get done, the message I gave is probably going to be different than the 10th person who received it. So we call this the communication cycle. All right, learning to communicate well is a skill. Human behavior and needs, developmental strategies of the life cycle. The infant has trust versus mistrust. The toddler, autonomy versus shame and doubt. The preschooler, initiative versus guilt. The school age person, industry versus inferiority. Adolescence, ego identity versus role confusion. The young adult, intimacy versus isolation. The middle adult, generativity versus stagnation. And the older adult, integrity versus despair. These are developmental stages of our life cycle. As an infant, we need to trust. We need to learn trust. A toddler autonomy is all about me, me, me. You know about the 2-year-old? When a 2-year-old looks in the mirror, all they see is themselves, that kind of thing. So you can go over that PowerPoint to try to understand what's happening here. Our next PowerPoint shows us Maslow's hierarchy of human needs, and you will need to understand this. So this hierarchy system of organization and ranking, it's about from the basics to the fullest possible, pleasant, everything's wonderful in my world kind of needs. And this is what Maslow calls his hierarchy of human needs. And these are basic needs, not deficiency needs, but basic needs. Physiological, we need air, water, food, sleep, and sex as a human person. The state of balance needs is homeostasis, and homeostasis is a balance of everything, so we're on an even keel. Safety offers us security and shelter. Loving and belonging is acceptance in our society. Esteem is from yourself and from others to validate you. And then self-actualization. Have you reached your full potential? Are you who you want to be at any given time? And by the way, this is an ongoing process. It doesn't just happen once in your life, but it's ongoing. So let's look and see what these pictures tell us on the next slide. The physiological needs are to satisfy drives for hunger, thirst, and sex. So if we look at the bottom of the pyramid, we have sleeping, we have water, all right, and we're being taken care of. Safety needs to feel safe, secure, and out of danger, a safe place to work, a safe place to live. Belonging and love needs, about being accepted in a group and feeling loved by others, both family and friends. Esteem needs here in the green is about achievement and being literally patted on the back and recognition, and we all need it. There isn't one person that I know of that does not need some type of recognition for the accomplishments in their life. All right? In theater and acting, in the movies, you get the Golden Globe Award or the Oscar. That's way up there. But for those of us that do a job here, one of my things I've always noticed with different managers that I've had is the one thing I've learned from managers is that they don't validate their employees very much. They don't say good job done, nice job done very much. Think about that if you're working and see if that doesn't ring a bell. What about self-actualization? To achieve your unique potential. You're here to become medical assistants. When you finish this program, you have reached self-actualization in the goal of becoming a medical assistant. That's why I said these are ongoing, depending on what you're doing. We have types of communication in our life. We have positive verbal communication, and it promotes patient comfort and well-being. Hello, Mrs. Jones. It's nice to see you again. Please come in and have a seat. I'm going to take care of you today. Instead of, Mrs. Jones, room 3, I'll be there in a minute. All right, so let's do some positive verbal communication versus negative verbal communication. Mumbling, speaking sharply, interrupting, or rushing through explanations. Oh, so you want to know why we have to do an x-ray? Because something's wrong with your leg. I'll be back in a minute. That is some very negative verbal communication, all right? Nonverbal communication is called body language. Facial expression is probably the most expressive and the most seen type of nonverbal communication. Eye contact. In some cultures, you do not make eye contact. All right. And posture. We have open posture and closed posture. My favorite example of closed posture is someone with their legs crossed and their arms crossed. They are not going to listen and not going to like what you have to say. All right. Touch is very powerful. We've heard all about this for the last 20 years. Stay out of people's personal space, ask for permission to touch them. And again, when you're taking care of a patient, you really do need to explain to them what you're going to do. I'm going to be taking your blood pressure and touching you today. Is that all right with you? And maybe that sounds crazy to you, but that's the professional way to do things. All right. And when we're communicating with patients, don't get too close to them. They still need to have their own personal space as you do. Listening skills. Do you know how to listen? Not just hear what's being said, which is passive listening, but to understand and respond back to what's being said. That's known as active listening. So right now, some of you could just be passively listening to me going, wah, 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 here's another lecture. Some of you are actively listening and taking notes or thinking about what's being said. You see these two dogs? Look at me when I'm talking to you. That kind of explains it. Let's talk about improving listening skills. How do you prepare to listen? Be ready to listen and give the person time to explain to you what they need to say. And don't pretend to listen. Actually listen. Make eye contact if that is appropriate, and pay attention to that personal space. Think before you speak. Take a few seconds to hear what they're saying. And if you need a further explanation or you need questions answered, then you can go ahead and say, thank you so much. I understand what you're saying, or I'm not quite sure. Let me know if I've got this right. So improving listening skills and communication skills is an ongoing process. Interpersonal skills are skills used to interact with people. Warmth and friendliness are portrayed in a sincere smile. When you came into the classroom today, good morning, everyone, how are you? Your instructor probably smiled at you and asked you how you were doing. Empathy and understanding another's feelings. Now, sympathy and empathy are two different things. Sympathy means you are kind of reliving that person's problems because you've had them yourself. Empathy is you understand the problem, but it's not part of your emotional being. All right? So having empathy and understanding that maybe your best friend's having a bad day. I understand you're having a bad day. Okay? I'm so sorry. Respect. Avoid being judgmental. No matter what the person is doing, especially and if you work in pediatrics, the parents who absolutely refuse to have their children vaccinated on religious grounds or personal belief, we need to respect that and not judge them as bad parents. We need to say, thank you so much for explaining that to me. You can speak with a physician about it. We need to respect other people's decisions. We need to respect the people who choose to have an abortion. We need to respect the people who choose not to have cancer care and just want to be left alone and die quietly. We need to respect everyone's wishes no matter what. We are not judging them. And we need to be genuine. We need to be real. We don't need to give lip service to people. All right? Openness is a willingness to listen and accept what's being said. As you work with patients, and in this willingness to listen and accept openness, as you receive information from your coworkers and your boss, whether it's critique, professional criticism, or ideas, or hey, that was a great job you did with the kid, he was really scared. We still need to be open and willing to listen and accept what's being said. Consideration and sensitivity goes along with this too. Be considerate. If you're having, you've got all of a sudden diagnosed with something you never thought you'd have, or there's potential for something horrible, and you're in your doctor's office, the last thing you want to hear is, okay, so I'll see you later, bye. You don't want to be pushed out of the room. You want people to sit and listen to you. You want to get some feedback. So remember, and this interpersonal skills and communication skills, be the patient. How would you like to be treated? Assertiveness skills. You can be firm without being a bully. All right. You can stand by your principles while showing respect for others all over Facebook. You don't have to agree with me, but we can still be friends. All right. You don't have to agree with me, but we can still respect each other. All right. Avoid being aggressive or bossy. Assertive behavior demonstrates confidence, that you're confident in your position on a certain subject, but it's okay for other people to disagree with you. Use the I statements when you are having these assertiveness skills. I feel, I think. All right. What is therapeutic communication and therapeutic communication skills? Therapeutic communication improves patient relationships. Again, be silent and allow the patient to think without pressure. Is there anything else you need to tell me? Is there anything else you want to talk about? Give them time. Accepting in therapeutic communication is like a slight nod to acknowledge that you hear them and understand them. Give recognition by showing the patients that you see them. Offer yourself as available to meet needs, as in, please let me know if there's anything else I can do for you. If you're on the patient portal, we'll look for if you have a question before you leave, be sure to ask. And allow the patient to begin a conversation. All right, you get into the room. So, what brought you in today? And let them tell you. And you can general needs are such as go on and is there anything else? And could you expand on that for me? And make observations of problems you notice. All right. I was just recently at a meeting with a cardiovascular specialist, and she was talking about EKGs, and she had them up on the board. And I noticed that on one of them, there was a span of about 6 or 7 seconds with no blips. It was just a flat line. And I thought, oh, we got a problem here. And she went on to tell us about an older woman who had come into her office because she kept getting lightheaded. So the first thing the doctor says is, how did you get here today? Oh, I drove. It's okay, dear. So the physician looked at her and said, all right, we did this EKG on you, and your heart is stopping beating for 6 or 7 seconds at a time. It's in the top chamber of your heart. It's called atrial stenosis, and it's a problem. Oh, okay. What would you like me to do about it? So the doctor said to her, well, we're going to send you to the hospital by rescue right now. And the patient looked at her and said, oh, no, that's okay. I'm going to drive home, and then I'll have my next door neighbor, when his son comes home, he can take me over to the hospital. And she started to leave, and the doctor said, no, Mrs. So-and-so, I am so sorry, but we've already called rescue. You cannot go out driving because something, you may cause an accident and somebody else might get hurt, because I was just watching you for a minute and you weren't listening. You had this look on your face, your heart wasn't beating. So the doctor is observing what's going on with the patient and realizes that there's a moment of this lack of heartbeat. So make observations of problems you notice. All right. They don't have to be big ones like that, but they could be something that the patient isn't saying to you. Therapeutic communication improves patient relationships, and encourage this communication, saying, so tell me about it. What else happened? Does it hurt when you move your leg? Because you said your knee hurts. So, and mirror or restate what the patient said. And you want the patient to do that with you. When you're educating a patient on something, this is how you need to collect your urine specimen for 24 hours. Would you please repeat that back to me? You want to repeat what the patient said to you to make sure that you understand what they're telling you. And you want to ask the patient their opinion about certain things. All right. And you want to help the patient to stay focused, to stay on topic. I have a friend of mine who, when she gets excited or nervous, she just starts talking about anything under the sun. And we call this pulling her in, roping her in. It's like, all right, I'll call her Sarah. All right, Sarah, come on, get back. Tell us about, you were talking about your house and the front door, and all of a sudden you're talking about shopping at Walmart. So it's about helping the patients to stay focused and allow the patient to express themselves deeply. They need to be able to say things to you they won't say to anybody else. All right. And ask the patient to provide clarifying information. Again, it's kind of like mirroring and restating what the patient said, and summarize. So gather and organize important points of the discussion. So you were walking and you stepped off the curb and your knee felt funny, and for the last couple of days it's gotten worse and worse. So what happens when it makes it worse? That kind of thing, where you organize your thoughts. Ineffective therapeutic communication. These are called roadblocks. Reassurance can give false hope. Never tell a patient, we're going to make you feel better. Never tell a patient, the doctor's going to fix it and you'll be okay. Never, ever, ever give false reassurance. It can give false hopes. One thing you can say is the doctor's going to come and talk to you and we're going to see what we can do. Just like that. Giving approval, seek progress instead of praise. All right, when you give approval to someone, you've lost 10 pounds in the last 3 weeks. That's fantastic. And let's see if we can keep this going. So that's, you're validating their work, but you're not praising them. Disapproving, don't pass judgment. What else can I say? Agreeing and disagreeing, do not argue with your patient. Advising on anything is outside of the scope of practice. We've talked about scope of practice before, and I promised you I'd bring it back. You do not give advice to patients. Probing pushes beyond patient boundaries. So you have to learn, you get some information, but there's some places you shouldn't push into. Defending and being defensive about what a patient says to you, this shuts down patients' communication. They're not going to talk to you anymore. Again, don't be judgmental. Be open-minded and listen. Requesting an explanation might be intimidating. So instead of saying, would you explain that to me again? You could say, all right, so this is what I've got. Could you clarify this for me? Or could you help me understand it? That's a better way of asking for information. Minimizing feelings, again, don't be judgmental. And stereotype comments are impersonal. Again, you are the patient. What was it like the last time you went to the doctor's office? Defense mechanisms on the part of the patient. Compensation, overemphasis of a trait. Denial, reject unacceptable factors. Well, you say I have stage 4 cancer, I don't, and that's all there is to it. Displacement is when you transfer the blame to someone else. Well, I've been coming to this office for 5 years. Why didn't somebody pick it up before today? The doctor didn't do it. All right. Dissociation is denying emotional significance. Sarah, I'm so sorry to hear that your mother is in hospice care. Oh, that's all right. She'll be, I'm doing just fine. Identification is mimicking behavior of another, and introjection is adopting others' unacceptable ideas. Please understand those defense mechanisms and be able to give examples. Communicating in special circumstances, all right? So sometimes we have children who are scared, we have adults who are scared, we have all kinds of circumstances. Let's see what we have here. We have the ancient patient, which is often children or the elderly, and the angry patient. And usually anger is a mask for fear. Patients of other cultures. You have cultural differences, language barriers, limited reading skills, cultural competence. And you can also have educational problems where, where you may have a patient who says they understand, but they don't. So we need to be able to help them understand you need to take your vitamin D3 every day, whether the sun shines or not, whether you're out in the sunshine every day or not. You still need to take vitamin D3 for bone strength and keeping your bones healthy. All right, mentally or emotionally disturbed patients, remain calm if the patient is agitated or confused. Avoid raising your voice. All right, don't appear impatient and ask the patient to repeat if you don't first understand what they're talking about. But when you're with a mentally or emotionally disturbed patient, keep it calm and quiet and slow paced. And if they have someone with them, you look at the patient when you're speaking, not the person with them. Terminally ill patients, extreme stress is often present. All right. And hospice works with terminally ill patients as well. But know that if someone at the age of 35 has stage 4 breast cancer, it's the first time they've seen the doctor, they are going to be angry and bitter and just scared because they can't be cured. All right. So be prepared and be cognizant of terminally ill patients. What about patients, families, and friends? Well, first of all, let me say HIPAA precludes you from giving patients, families, and friends any information about them, no matter what, unless it's in writing in the office that says, you can tell my dad everything about me, or you can tell my wife everything about me. If that piece of paper is not signed in the office, you cannot give family and friends any information whatsoever. Now, if they are with the patient, they may provide emotional support to the patient. We're here with you. You know, you're going to have your tonsils out. I know you're 22 and it's going to hurt, but we're going to take care of you. And they may be a problem too. They may get in the way, and they may get in the way like you wouldn't believe. So ask your patient about their preference for having others present during the visit. Would you like your mom with you? You know, for a 15-year-old girl, she probably doesn't want her mother in the room. Would you like your mother with you? No. Ask them what they prefer and acknowledge the family and friends and communicate in the same way as with the patient. Now, if possible, if that approval is in place, you can keep them informed on the patient's status. But you have to protect patient confidentiality. If the patient does not want their wife to know what's going on in their healthcare, you cannot tell the wife a thing, no matter what the wife says. All right. If the husband and the wife come to the doctor's office, they go in the room, and then the man says, "I would like my," to his wife, "Please step out of the room while I see my doctor. I don't want you in here when I'm being examined." So she has to go to the waiting room. Well, if she tries to come back and say, "So what happened? What was going on? Tell me what the doctor said about my husband." I'm sorry, ma'am, but HIPAA precludes us from discussing your husband's care. You'll have to talk to him about it. So patient families and friends can be positive and supportive, and sometimes they're a roadblock. Now, the patient with AIDS and the patient who is HIV positive, you do know that AIDS and HIV are two very different things. HIV means you are infected with a human immunodeficiency virus. It does not mean you are AIDS active. It means that you have a virus in your body. There are people alive today who have had this virus in their body for almost 40 years and they're still alive. And there are people who passed away 2 years later after they were infected because the immune system was so ravaged and destroyed that they became AIDS active. Acquired immune deficiency syndrome means that you are now dying from the ravages of the HIV virus. So you need to know the difference because not everybody who is HIV positive has AIDS at all. And we need to be aware of this because of the social stigma, and the patient may be upset or depressed. And ask a few questions. Ask as few questions as possible, but answer as many questions as you can. All right, remember, stay within your scope of practice. Don't act fearful of being part of the care team. And always remember, whether this is an HIV, AIDS, a pregnant woman, a man with stage 2 cancer, it doesn't matter. Patients need to be treated with dignity. Every single patient, no matter what their condition is, need to be treated with dignity. Whether it is a heroin addict, or it is a child, an autistic child, or it is a woman with uncontrollable diabetes, or a man with emphysema because he smoked all his life, you don't get to judge. You will treat them with dignity and respect no matter what. I cannot emphasize this enough. How about communicating with your coworkers? This is a great picture. All right. Positive communication with coworkers helps to create a harmonious and a positive place to work. We call this rapport, and we do need to have a rapport with our coworkers. Communicating with management, you need to keep your supervisor informed, not of every single thing you do, but along the way. How was your day today, Carmel? Doing great, no problems whatsoever. Ask questions, but minimize interruptions with your management, and show initiative. If you see that something is always, a wastebasket is never emptied. After you've emptied it all week long, you can just mention to your boss, I'm not sure why this wastebasket hasn't been emptied all week. I've been doing it, but I don't know if our cleaning team even knows it's in here. Show a little initiative. One thing I learned many years ago was that if you have a problem and you go to your manager all the time with a problem, you better have a solution at the same time. Don't just go in there and complain, but have a possible solution. How do we deal with conflict? This picture says, can't we all just get along? Rock, paper, scissors. Conflict or friction between coworkers is counterproductive. It causes negative atmosphere. patients pick up on it immediately that people don't get along. All right. Don't join in on negative conversations. I was having a conversation with someone the other day about a job we used to work at many years ago. And there was this, everybody kept saying one manager was dating another manager. And I said, somebody said that to me a couple weeks after I started working there. And I looked at him and said, that's nobody's business. And that is so not acceptable in the workplace. Don't talk about people's personal lives in front of me again. That is conjecture and rumor, and I don't want to be a part of it. So stand up for yourself. Don't join in on those negative discussions. All right? Don't judge or stereotype anyone. Just say that's not something for the workplace. Be supportive and personable with your coworkers. Sure, let me help you out. Could you come and help me hold this little boy's hand? Sure, no problem. I have to put a cast on someone. Could you come hold their arm? Yes, I can. All right. Again, don't gossip, don't jump to conclusions, and don't join in on negative behavior and negative discussions. Setting boundaries in the healthcare environment is also a professional act of what we do. So make professionalism your first goal. You're going to be professional. All right. And by being professional, you will set physical or psychological boundaries, such as I'm not going to gossip in here about people. That is setting a boundary, and that helps to limit undesirable behavior. All right. Take immediate action against inappropriate behavior, but use tact and be diplomatic. So if you do hear some people talking about somebody, you very quietly go up to them and say, I don't think we should be talking about that here. Let's be professional, very quietly kind of thing. And if this is repeated or it comes up again, just report this behavior to your supervisor. All right. If you see someone, every time they walk out of a patient room, they're on their cell phone, that's inappropriate behavior. A lot of places don't allow you to have a cell phone in your pocket while you work. That if you constantly see them sitting in the break room on their cell phone when they could be inventorying supplies in the lab, and you say, hey, can you come help do this? But if you constantly see this and you're not the supervisor, you go to the supervisor. All right. We need to follow office policy and procedure at all times. If you're not sure what they are, ask your boss. That ends our lecture today on, that ends our lecture today on interpersonal communication, and I'll chat with you again next time.